In vitro fertilization or IVF has helped millions of couples achieve their dream of parenthood. If you're considering IVF or about to start treatment, understanding the process can reduce anxiety and help you prepare. IVF involves fertilizing eggs with sperm outside the body, then transferring the embryo to the uterus. Let me explain each step. This comprehensive guide will give you everything you need to know. Let's dive in and explore this topic together so you can feel confident and informed. The process begins with ovarian stimulation. For about 10 to 14 days, you'll take injectable medications to stimulate your ovaries to produce multiple eggs instead of just one. During this time, you'll have regular monitoring appointments with ultrasounds and blood tests to track follicle development. When your follicles are mature, you'll receive a trigger shot of HCG to finalize egg maturation. Exactly 34 to 36 hours later, your eggs are retrieved in a minor surgical procedure using ultrasound-guided needle aspiration. You'll be sedated and the procedure takes about 20 minutes. On the day of egg retrieval, fresh sperm is collected or frozen sperm is thawed. In the laboratory, embryologists fertilize the eggs using conventional insemination or intracytoplasmic sperm injection, called ICSI, where a single sperm is injected directly into each egg. Fertilization results are shared the next day. Embryos develop in the laboratory for 3 to 6 days. Many clinics culture embryos to the blastocyst stage at day 5 or 6, which may improve success rates. Some embryos may be genetically tested through PGT to check for chromosomal abnormalities before transfer. Embryo transfer is a simple procedure that doesn't require sedation. A thin catheter deposits the embryo into your uterus under ultrasound guidance. You may feel mild cramping. Afterward, you'll take progesterone to support the uterine lining. The dreaded 2-week wait until your pregnancy test begins. Success rates vary based on age, diagnosis, and embryo quality. For women under 35, the success rate per transfer is typically 40 to 50% with their own eggs. Rates decline with age. Many couples need multiple cycles to achieve pregnancy, though some succeed on their first try. IVF costs range from $12,000 to $20,000 per cycle in the United States, not including medications which can add $3,000 to $5,000. Some insurance plans cover fertility treatments. Many clinics offer payment plans or package deals for multiple cycles. The IVF journey is emotionally and physically demanding, but for many, it's the path to their longed-for family. Work with a supportive fertility team and lean on your partner, friends, or support groups. Thank you for watching. Please subscribe and hit the bell for more fertility content. Start tracking your IVF journey with Ovuloom.